What's up, my average med students? If you're watching this video, that means you probably finished the OBGYN Part 1 and Part 2 High Yield Review, ANKI with me. So thank you very much, and if you like this video, I hope you subscribe and share it with other average students just like yourself. Let's keep going. Does a first trimester surgical abortion predispose patients to subsequent first trimester SAB, primary infertility, or other obstetric problems? No, and no, and no. What causes later decelerations? Placental insufficiency. What is the first test that should be done, that should be performed in primary infertility? Semen analysis. LSIL on pap smear. What's the next best step in management? Colposcopy. What is post-exposure prophylaxis for HPV? HPV IG and HPV vaccine. Extensive PPH followed by slow maternal function or slow mental function, weight gain, fatigue, cold intolerance, lack of milk production, amenorrhea, hypotension for years after pregnancy. What's the most likely diagnosis? What hormones are low and how do you treat this? This is Sheehan syndrome. GnRH, TSH, ACTH, estrogen, progesterone, and thyroid and adrenal hormones are all low, and you treat it by giving supplemental hormones. What can PID be caused by aside from GNC? Genitourinary and GI infections. What does cryoprecipitate contain? Fibrinogen, factor 8, and von Willebrand factor. What is the gold standard of treatment for endometriosis? What should be done in a young patient? Surgery and ablation to preserve the fertility. What test is used to look for Down syndrome in second trimester? Quad screen. You're checking for AFP, beta HCG, estriol, and inhibin A. What type of fibroids can cause recurrent abortions or infertility? Submucosal or intracavitary myomas. When is CVS done? Chorionic villus sampling. What can be detected? 10 to 12 weeks. Fetal chromosomal abnormalities, DNA, biochemical, and base studies. What is HSV outbreak preceded by systematically and locally? Cold-like symptoms, burning, and irritation. Patient with favorable cervix at 41 weeks or more gestational age. What's the next best step in management? Induced labor. When should babies begin breastfeeding? Within half an hour of delivery. Copper penny macular rash on palms, soles, and vulva. What's the most likely diagnosis? What will be seen on dark field microscopy of sample from the lesions? Are VDRL and RPR specific for this? Syphilis, and you'll see spirochetes, and VDRL and RPR are highly sensitive but not specific. What is the etiology of exercise-induced amenorrhea? Depression of HB axis. Withdrawal of what hormones allows alpha-lactalbumin, which is milk production, to begin after delivery? Estrogen and progesterone. What is the most common cause of postpartum fever? Endometritis. What female organs are involved in arousal and orgasm? The external genitalia, clitoris, labia, and vulva. What is the carrier frequency for Gaucher disease in Ashkenazi Jews? And what about Tay-Sachs disease? 1 out of 15 for Gaucher and 1 out of 30 for Tay-Sachs. Twin pregnancy. What should be done if the presenting twin is in breech position? C-section. What is the most appropriate treatment for PCOS, and what effect will they have? OCPs, and they regulate her cycles. Can an investigator own stock in a company if he or she does research for that company? What must be done in that case? Yes, but must declare and address conflict of interest. What are the potential complications of epidurals? Spinal HA, localized back pain, and meningitis. Spinal headache, I guess. What is the most common cause of itchy nipple, allergies, dry skin, inflammation, and physical irritants. What is the best first step in symptomatic prolapse? A pessary fitting. Patient presents with greater than expected AFP and fetal height. Next best step in management, and what's the possible diagnosis? Fetal ultrasound, multiple gestation. What causes minute ventilation to increase during pregnancy? Increased tidal volume. Fever, bleeding, dilated cervix, likely diagnosis. Septic abortion. What are the possible complications of using bromocriptine to prevent lactation? Hypertension, strokes, and seizures. What are the most common causes of Asherman syndrome, curettage, and endometritis? Is mastectomy for breast cancer contraindicated in pregnancy? No. How do OCPs decrease dysmenorrhea? The progestin causes endometrial atrophy, causing lesions, causing less prostaglandins to be produced by the endometrium. How much weight should a patient with BMI of 25 to 30 gain in pregnancy? 15 to 25 pounds. What is the cause of pruritus gravidum? How is it treated? Mild variant of intrahepatic cholestasis of the pregnancy, and you can give ursodeoxycholic acid. Hard cervical lesions that bleed. What's the most likely diagnosis? Cervical cancer. What is the first step in induction in patient with closed cervix? Prostaglandin E1 tab. What is the gold standard for diagnosis of genital herpes? Is it specific, highly sensitive? Viral culture, it's specific, and it's not highly sensitive. 10 to 20% will be false negatives. Should women with bacterial vaginosis in pregnancy be treated? With what, and again at delivery? Yes, with the oral metronidazole, and no, not at delivery. What is it called when the cervix bleeds upon dilating in labor? Is it clinically significant? It's called bloody show, and it's not clinically significant. How can women prevent transmission of HSV while having oral sex? Dental dam or latex condom. How often does asthma worsen in pregnancy? What should be added into SABAs, short-acting beta agonists in these cases? 40% and inhaled corticosteroids or cromolyn sulfate. What hormone is deficient in Kallmann syndrome? What is the sensory defect, and how do you treat this? GnRH is deficient, and the sensory is smell, and you can give pulsatile GnRH. When in the course of herpes is it best to obtain a specimen for culture? Early. What causes variable decelerations? What are patients with PROM at increased risk for? Cord compression, and they have a lack of amniotic fluid. How are central and lateral cystoceles repaired? Fixing defects in the pubocervical fascia or reattaching it to the sidewall. Should tocolytics be used in case of intraamniotic infection? No. How should a person who has power of attorney base their decisions? Off of what the patient would have wanted. What is the primary risk factor for PROM, and what especially? Genital tract infections and bacterial vaginosis especially. What kind of conferences can pharmaceutical companies pay for? Medical conferences where physicians receive CME credits. What is the most common reason mothers receiving RhoGAM still become sensitized to RH, and why? More fetal hemorrhage than estimated. RhoGAM is dose dependent. What should be for antepartum surveillance in post-term pregnancy? NST and amniotic fluid monitoring. What should be done in case of umbilical cord prolapse? C-section. What are serum ferritin levels in iron deficiency and anemia? Low. What do parent guardians have a right to know, and what do they not? Overall health and sexual information. They don't have a right to know the kid's sexual information. What should be done in a patient with first-degree relative with colon cancer before age 60? When should colonoscopies be started, and how should they be repeated? Colonoscopy starting at age 40 or 10 years before onset of cancer. In relative, every 5 years should be repeated. What type of fetal heart tracing can amnioinfusion be used to treat? Variable decelerations, such as cord compression. Which has a higher chance of developing into malignancy, partial or complete moles? Complete moles, 46XX variant. What are the risk of complications in children of diabetic mothers related to? Control of diabetes mellitus in the first trimester. What are macrosomic infants at risk for? Shoulder dystocia, hypoglycemia, neonatal jaundice. What is placenta accreta, and what previous procedures put patients at risk for it? Placenta grows into myometrium. Previous C-sections put patients at risk for it. Infant with Rh hemolytic disease and Lilly curve value in zone 3. What does this indicate, and how do you treat this, and what if this is not possible? So it is severe hemolytic disease and indicates intrauterine intravascular fetal transfusion. And if it's not possible, then you do maternal plasmapheresis. When in delivery indicated in an intrauterine growth retardation fetus with oligohydramnios or abnormal umbilical artery Doppler studies. 36 weeks. What is the mechanism of action by which magnesium relaxes the muscle? Competes for calcium entry into the cells. Why is endomethacin contraindicated after 32 weeks? Increased risk of PDA closure. What should be done with cervical leukoplakia? Biopsy. Refractory PPH due to uterine atony requiring XLAP. What should be done? What should be placed? And what should be considered if this doesn't work? A B. Lynch suture and hysterectomy. What is the first step of treatment of infected wound, and when should it be repaired? Debridement of necrotic tissue after infection has resolved. What should be used to stop preterm labor before 32 and 34 weeks? CCB, calcium channel blockers like nifedipine. What is the pregnancy rate with vaginal diaphragm? 18%. What should be checked in all women with vaginal bleeding in pregnancy, even if it's non-viable? Maternal blood type. What is the therapeutic magnesium level, and when does loss of deep tendon reflexes occur, and respiratory depression and cardiac arrhythmias? The therapeutic magnesium level is 4 to 7 milligrams, and then loss of deep tendon reflexes occur at 7 to 10, and then respiratory depression 11, and 15 and up is when you see the cardiac arrhythmias. What is the mortality for mothers with pulmonary hypertension in pregnancy? When are they at greatest risk? 25 to 50%, and when there is diminished venous return and right ventricular filling. Recurrent urgency and frequency with dyspareunia and pelvic pain. What's the most likely diagnosis? Interstitial cystitis. Patient with slow rising beta HCG level less than 50% in 48 hours, that is over 2000, and not visible IUP, and no visible IUP in ultrasound. Hemodynamically stable. What's the most likely diagnosis and treatment? Ectopic pregnancy, and you treat that with methotrexate. What is a prolonged dilute viper venom test associated with? Antiphospholipid syndrome. Most common cause of PPH? Uterine atony. Small erythematous lesion in shaved region. Most likely diagnosis? Folliculitis. What are HPV-infected women who are immunosuppressed at higher risk for? Condyloma or vulvar dysplasia. What are infants of diabetic mothers at increased risk for besides macrosomia in GDM and intrauterine growth retardation in DM1? polyhydramnios, congenital malformations, cardio and neural, preterm birth, and hypertensive complications. Whose responsibility is the patient's privacy? Physicians and other healthcare providers. Patient with beta HCG over 2000, no IUP on ultrasound, hemodynamic instability. What's the most likely diagnosis and next step? Ruptured ectopic pregnancy, and next step would be to do exploratory laparoscopic or laparotomy. Is IUGR associated with polyhydramnios? No. What should be screened for in all sexually active patients under 25 years old? Chlamydia and gonorrhea testing. Globular mass appears at placenta while trying to deliver the uterus. Likely diagnosis and risk factors. Uterine inversion and multipurity and multiple gestation, polyhydramnios and macrosomia are the risk factors. How much does carbon monoxide increase in pregnancy? Due to heart rate, stroke volume, or both? 33%, and it's due to both. Sorry, that was not carbon monoxide. That was cardiac output. Sorry. Fever, tender uterus, increased WBCs, and what's the most likely diagnosis? Intraamniotic infection. What is the differential of postpartum fever? Endometritis, cystitis, and mastitis. What should be offered to all rape victims to decrease STIs? Prophylactic antibiotics. When should colon cancer screening be started, and what are the options? Age 50, colonoscopy every 10 years, and sigmoidoscopy every 5 years, and fecal occult blood testing yearly. What type of feeling can differentiate postpartum depression from postpartum blues? The ambivalence towards newborn. Abnormal pap colposcopy reveals CIN. What's the next best step in management? LEAP procedure. Who does mifepristone prevent pregnancy in? Prevents, or how does, I guess, prevents ovulation because it's a progesterone agonist. Abnormal uterine bleeding. What's the best next step in management? And if it's negative, so you do a pregnancy test first, and if it's negative, you do a pelvic ultrasound. How does progesterone decrease anovulatory bleeding? It changes the endometrial growth from proliferative to secretory phase. Why does hysterectomy not help PMDD? It doesn't influence hormones. What surgical component are recommended in early endometrial cancer? Extrafascial, TAH, BSO, pelvic, para-aortic, lymphadenectomy. What bacteria is most simple mastitis caused by? And how do you treat it? Staph or streptococcus, and you treat it with antibiotics. What is the most accurate way to assess gestational age? First trimester ultrasound. What should not be done for breastfeeding or breast cancer in pregnancy? Radiation. What is most common cause of cystitis after vaginal delivery? E. coli. What do symptoms of domestic violence often present as, and is reporting mandatory? Vague, PMS-like, and no, it's not mandatory. You need the patient's consent. How should a mother and baby be positioned during breastfeeding? Belly to belly. Positive pressure ventilation of the neonate. What is the correct head position, and what is the required O2 flow rate, and what should be observed for? Sniffing position, head tilted and chin lifted, 10 liters per minute, and you should look for chest rising. What other disorder in Mullerian agenesis? What should be done when it is diagnosed? Renal abnormalities and renal ultrasound. What type of tumor secretes testosterone, and what is FSH and LH likely in these patients? Sertoli-Leydig, FSH and LH are suppressed. What is the definition of secondary arrest of dilation, and what's the next best step in management, and if not adequate contractions? No cervical change in active phase for 4 hours. You do an amniotomy, And you can, and if there's still no adequate contractions, then you give oxytocin for augmentation of labor. What should be given to patients with PPROM and why? Ampicillin and erythromycin to reduce neonatal sepsis, maternal amniotis, and prolong the latency period. Maternal use of what contraindicates use of naloxone in neonate and why? History of substance abuse, especially narcotics, and may precipitate life-threatening withdrawal. Precocious puberty in 4-year-old with high DHEA and DHEAS, likely diagnosis, 21-OH deficiency, congenital adrenal hyperplasia. Low pelvic pain, urinary frequency and urgency, what tests should be performed and why? Urine analysis and you suspect UTI. Does IUD placement affect milk production? No. What is used to treat SLE arthritis and serositis in the first 2 trimesters of pregnancy? NSAIDs. Progesterone level above 25 per milliliter suggests what? Healthy pregnancy. How much weight should patients with a BMI of 18.5 to 25 gain in pregnancy? 25 to 35 pounds. What is the most common side effect with fluoxetine? Insomnia. What options should parents with an intrauterine demise have? When or where to deliver, to hold the baby, and autopsy. What is the criteria for a missed abortion? Crown rump length over 7 millimeters with no cardiac activity. When is DEXA scan screening for BMD started? What factors warrant starting earlier? 65-year-old, early menopause, glucocorticoid therapy, sedentary lifestyle, alcohol consumption, hyperthyroid, hyperparathyroid, anticonvulsant use, vitamin D deficiency, family history, early or severe osteoporosis, and chronic renal or liver disease. When should obese patients or patients with family history of diabetes mellitus be screened for GDM? As soon as possible. What factors cause increased rates of spontaneous abortions? Smoking, alcohol, radiation. Is a fetus seen a complete mole or partial mole? No, and it might be a partial mole. Vaginal area that is exquisitely sensitive to touch and does not have any lesions or macules. What's the most likely diagnosis and what's the treatment? Vestibulodynia, and you can give TCAs, topical anesthetics, pelvic floor rehab. What type of incontinence does diabetes mellitus and mitral stenosis cause? Overflow. What state is the endometrium of patients with anovulatory bleeding in? Proliferative. Mild anemia that is microcytic and hypochromic with normal hemoglobin electrophoresis, normal ferritin. What's the most likely diagnosis? Alpha thalassemia trait. What is the greatest risk factor for ectopic pregnancy and what is the increased risk? Prior ectopic pregnancy and the increased risk is about tenfold. What should be done if a patient's endometrial sampling shows atypical cells? No further testing should be done with DNC. What should be done if a patient has an arrest of labor? What if cervical change does not occur with this? Start oxytocin, place IUPC to assess the strength of contractions. What should be done to treat a possible infection of C-section incision? Open the wound and drain it. Pack it to ensure that it heals from the base up. What placental position increased the risk of placental accreta? And what's the surgical history? Low-lying anterior and surgical history of C-sections. What treatment of hyperthyroidism is contraindicated in pregnancy? Radioactive iodine. When is BP treated in preeclampsia? What are the first-line agents and what is the goal for DBP and why? When over 160/105, hydralazine or labetalol 90 to 1 and is the treatment, and 90 to 100 should be the diastolic blood pressure, and this is to prevent maternal stroke without compromising fetal perfusion. Polyhydramnios in one twin and oligohydramnios in the other likely diagnosis, and what's the number of placenta and the number of amnions. Twin-twin transfusion syndrome, and the number of placenta and amnions would be diamniotic monochorionic. How should asymptomatic bladder prolapse be treated? Observation. What histological finding places patients at greatly increased risk for endometrial carcinoma? Complex atypical hyperplasia. What is the most common lower genital tract malformation, and how do you treat it? Imperfect hymen, and you treat it with surgery. What should an obese patient with acanthosis nigricans be screened for? Diabetes. What tool can be used to establish diagnosis and guide the treatment of PMDD, PMS? Symptom diary. What is the cause of true precocious puberty, and what CNS abnormalities are increased? Increase in pulsatile GnRH secretion, CNS tumors, and hamartomas are increased. What is the inheritance of sickle cell anemia? What is the prevalence of carrier trait in the Black population? It's autosomal recessive, and it's about 1 out of 10. What should be done if a patient's endocervical curettage is positive for a high-grade lesion? Cervical conization. What should be obtained in a female patient with lower abdominal pain? A pregnancy test. What are examples of long-acting reversible contraceptives, LARCs? IUDs and sub-Q implants, like Nexaplanon. Infant born to diabetic mother, what's the glucose, hematocrit, bilirubin, and calcium? So glucose will be low, hematocrit will be high, bilirubin will be high, and calcium will be low. What should be done with palpable breast masses? Fine needle aspiration or biopsy? What birth control methods have an under 1% pregnancy rate? Depo-Provera, IUD, male, female sterilization, and Implanon. What type of incontinence is associated with detrusor muscle overactivity? Urgent continence. What is a patient with long-standing diabetes mellitus with cardiovascular compromise at increased risk for? Intrauterine growth retardation. When do yeast infections commonly occur in girls? After antibiotic therapy. What hormone level should be ordered if the expected cause of amenorrhea in HPA axis depressed? FSH. What is the most common location of metastases from endometrial cancer, and what should be done after diagnosis is established? Lungs, and you should do a chest x-ray. What can be used in pregnancy to treat migraines? Amitriptyline. Patient status post-oophorectomy has cyclical ovarian pain. What's the most likely diagnosis? Ovarian remnant syndrome. What should be done when there is a discrepancy between fetal size and gestational age? Pelvic ultrasound. Newborn is withered, meconium stained, long-nailed, fragile, and has small associated placenta. Likely diagnosis, and what is the greatest risk factor for this? Fetal dysmaturity, and the risk factor is post-term birth. Patient having spontaneous abortion is not hemodynamically stable. What's the next best step in management? Dilation and suction curettage to stop the bleeding. Is gestational diabetes mellitus associated with the risk of congenital anomalies and pre-existing diabetes mellitus? No, but it is associated with pre-existing diabetes mellitus. Treatment for detrusor instability. Anticholinergics, especially oxybutynin. What should be tested to determine if rupture of membranes have occurred, and how? Vaginal fluid, ferning, and nitrazine testing. When can methotrexate be used to induce termination of pregnancy? When last menstrual period was less than 6 weeks ago. Why should a patient with vaginal bleeding not be started on hormone therapies? They may have endometrial cancer. What are omphalocele and neural tube defects associated with? How are they diagnosed? Increased maternal serum AFP, and you diagnose them with ultrasound. What are Plan B pills, and when should they be taken? They're levonorgestrel, and it should be taken within 72 hours of intercourse, no more than 120 hours. What is the cause of the most first trimester spontaneous abortions? Fetal genetic abnormalities, especially chromosomal abnormalities. In a patient with hypothyroidism and hyperprolactinemia, what should be treated first? The hypothyroidism. What nerve innervates the labia, and where does it originate? Ilioinguinal, and it originates in the T12 to L1. What is contraindicated in VBAC patients? Prostaglandins. How often should a pap smear be performed between ages 21 to 30? Should HPV testing be done? No, it should not be done, and it's performed every 3 years. Pelvic pain status post gynecological surgery. What's the most likely diagnosis? Pelvic adhesive disease. What is a contraindication to MMR and varicella vaccine? Pregnancy or possible pregnancy within 4 weeks. What is the most common type of breech presentation, and what is the presenting part? Frank breech and the buttocks. What is the pregnancy rate with male condom? 12%. Fetus with low heart rate with head visible in the introitus. What's the next best step? Assisted vaginal delivery with forceps or vacuum. Does a medical or surgical abortion have more blood loss? Medical. What lab value is evaluated in choriocarcinoma? Beta-HCG. What is the relative risk of ectopic pregnancy in a patient 35 to 44 years old? 3 times the risk. What is septic thrombophlebitis of pelvis, and how do you treat it? It's thrombosis of the venous system of pelvis, and you treat it with anticoagulation short term. Infant born with flattened nasal bridge, small size, small rotated cup-shaped ears. What's the possible diagnosis, and what other features should be looked for? Down syndrome, and you should also look for sandal gap toes, hypotonia, protruding tongue, short broad hands, simian crease, epicanthic folds, and oblique palpable fissures. How many stools should a baby produce over 24 hours? Wet diapers. 3 to 4 and 6 wet diapers. Patient with elevated AFP, what's the next best step in management? Fetal ultrasound. What are the complications from LEAP procedure? Infection, bleeding, cervical stenosis, persistent disease, risk preterm delivery. What are clue cells indicative of, and what happens when KOH is applied to the sample? Bacterial vaginosis, and when KOH is applied, you smell a fishy odor. Ascus with negative HPV, what's the next best step in management? Pap smear in 3 years. What is a category B drug? Animal studies have revealed no harm to the fetus. What type of pregnancy do twin transfusion syndrome occur in? Monochorionic. What are early decelerations a sign of? Fetal head compression. What causes variable decelerations? Umbilical cord compression. Patient with PPROM at 36 weeks gestation, what should be done and why? Augmentation of labor expectant management will increase the risk of chorioamnitis. What are the 2 greatest risk factors for breast cancer? Age and gender. What should be done in an infant without respiratory effort? Positive pressure ventilation and intubation. When should an ultrasound be used to date a pregnancy between 14 to 16 weeks? When there is over a 7-day discrepancy between it and the last menstrual period. Patient has burning with breastfeeding, pink shiny nipples with peeling in the periphery. What's the most likely diagnosis and treatment? And who else should be treated? So it's most probably candidiasis. You can give topical azoles, antifungals. And you should also treat the baby with oral nystatin followed by oral fluconazole. What is the most common type of vulvar cancer? What can it arise from? Squamous cell carcinoma and can arise from lichen sclerosus. What are the causes of increased breech presentation? Premature, multiple gestations, genetic disorders, polyhydramnios, hydrocephaly, anencephaly, placenta previa, uterine anomalies, and uterine fibroids. Mucocutaneous eruptions that are lacy and reticulated, also lesions in hair-bearing areas of the skin. What's the most likely diagnosis? Lichen planus. Patient with hydramnios with rapid decompression of the uterine cavity due to oxytocin use begins to bleed. What's the most likely diagnosis? Placental abruption. Treatment of uncomplicated vulvovaginal candidiasis. Azole cream. What must be present to use forceps delivery? Complete cervical dilation, head engagement, vertex presentation, and adequate maternal pain control, and ROM, rupture of membranes. When is informed consent not needed? Emergency situations that would risk the patient's life. Pelvic pain with varicosities on ultrasound. What's the most likely diagnosis? Pelvic congestion syndrome. What are 3 ways an ectopic pregnancy can be diagnosed? Fetal pole outside the uterus on ultrasound, beta HCG over 2000 with IUP on ultrasound, and continually rising beta HCG after DNC. Treatment of ovarian torsion. Surgical exploration. What populations is beta thalassemia increased in? Mediterranean. What is the average length of twin gestation? 35 to 37 weeks. What is the treatment of multifocal VIN2? CO2 laser ablation of the lesions. What component of amniotic fluid should be measured to classify the severity of Rh hemolytic disease? Bilirubin. What T-scores correlate with osteopenia? -1.0 to -2.5. What size babies are more common in gestational diabetic moms? And what is the blood sugar likely to be after birth? Large, and the blood sugar is likely to be low after birth. What type of infections are most cases of endomyometritis? Ampicillin and gentamicin. Pregnant women with hypertension and seizure. What's the most likely diagnosis and treatment? Eclampsia, and you treat them with magnesium sulfate. Why do pregnant patients experience normocytic anemia, and when does it peak? Plasma volume increases more than RBC mass, and it's dilutional, so it peaks around 34 weeks. What type of insults cause symmetric intrauterine growth retardation? Intrinsic growth failure, organ system anomalies, fetal aneuploidy, chronic intrauterine infection. What is a category D drug? Well-controlled observational studies in pregnant women show no risk to fetus, or show known risk to fetus. What kind of murmur do 95% of women have in pregnancy, and why? Systolic, because of increased volume. I believe they call this a flow murmur. What is the mechanism of action of methylergonovine? Sorry, I'm butchering that. What is it used for, and when is it contraindicated? It's smooth muscle constrictor, also vasoconstrictor, PPH due to uterine atony, and patients with hypertension and or preeclampsia. How does endometrial cancer normally metastasize to the lungs? Multiple pulmonary nodules. What are contraindications to estrogen-containing OCPs, and what should these patients be placed on? History of thromboembolic disease, lactating women, women over 35 who smoke, women who have nausea and combined OCPs, progesterone-only pills. What should be done in a patient with irregular uterus whose bleeding causes iron deficiency anemia? EMB to rule out endometrial hyperplasia and cancer. What thyroid measurements are increased in pregnancy and why? And should this cause any symptoms? Total T4 and T3, increased thyroid binding globulin, no free T4 and free T3, stay the same. What is the single greatest risk factor for third and fourth degree lacerations during delivery? Median episiotomy. What should be done with date rape? Screen for STIs and recommend emergency contraception. Treatment of VIN3, wide local excision. Should asymptomatic, relatively small fibroids be treated? No. What can be used to enhance fertility in a patient with endometriosis? Ovarian stimulation with clomiphene citrate. What percent of all normal pregnancies experience first trimester bleeding or spotting? 30%. What is the mechanism of terbutaline and what are its side effects? Beta agonists, and the side effects are tachycardia, hypotension, anxiety, and chest pain. Why should a digital exam not be performed if rupture of membranes is suspected? Possible introduction of bacteria and increased risk of chorioamnitis. What is the best test for evaluating metastases of the peritoneal cavity? CT abdominal pelvis. How much weight should a patient with a BMI over 30 gain in pregnancy? 11 to 20 pounds. Elevated prolactin, what's the next best step? TSH and brain MRI. What is the most effective treatment for hot flash symptoms? Estrogen. What vitamin deficiency has been shown to increase PMS symptoms? Vitamin A, E, and B6. What is the greatest risk factor for shoulder dystocia? GDM. What ultrasound findings is the most accurate at assessing fetal age? Crown rump length at 6 to 12 weeks. Elevated beta HCG with no evidence of IUP. What's the most likely diagnosis and the next step in management? Gestational trophoblastic neoplasm, and you evacuate the uterus. What should be done if patient is unsure about rupture of membranes? Speculum exam with nitrazine test. What is the treatment of syphilis at all stages? Penicillin G. What should be done in all cases of suspected sexual abuse? Notify the police. What is the most important thing to rule out in amenorrhea? Pregnancy. What should be done if a patient is found to have an STI in addition to treating the STI? Screening for all other STIs. What lab confirms the diagnosis of PCOS? Testosterone. What are some signs of magnesium toxicity? Muscle weakness, loss of deep tendon reflexes, nausea, and respiratory depression. Intermenstrual bleeding. What's the next best step in management? Pelvic ultrasound. What type of IUD decreases bleeding? What cancer does it decrease risk for? Levonorgestrel, and it decreases risk for endometrial. What percent of twins are born preterm and triplets and for quadruplets? 50% of twins, 90% of triplets, and 100% of quadruplets are born preterm. Pharmacological treatment of frequency and urgency incontinence. Oxybutynin, which is an anticholinergic. What is the drug of choice for anticoagulation in pregnancy? What is contraindicated? Low molecular weight heparin, and warfarin is absolutely contraindicated. What type of diseases are associated with early pregnancy loss, and does it matter how well they are controlled? Systemic diseases such as diabetes mellitus, SLE, renal disease, and yes, poor control causes increased risk. Who should be notified when elder abuse is suspected? Social services. What should be done for 3 to 6 months before a patient has fibroid surgery? GnRH agonist therapy. What is the most common cause of sepsis in pregnancy? Acute pyelonephritis. What strategies may be used to relieve breast engorgement? Frequent nursing, warm shower compress, and massaging breast to express milk. Does HELLP cause severe liver dysfunction due to because of prolonged clotting times? And does acute fatty liver of pregnancy? No, but acute fatty liver pregnancy does cause severe liver dysfunction. What kind of vaginal discharge does trichomoniasis produce? And would it cause fever or abdominal pain? Yellow, frothy, but it does not cause fever and abdominal pain. Alright guys, that about wraps it up. We completed 258 cards today. Thanks for watching, and if you really like the content, please share with your friends so they can benefit also. And I really hope that you benefited, and good luck on all your exams, whatever you're studying for. And please subscribe, and I'll probably be launching some videos on surgery cards pretty soon. So you don't want to miss out on that. So please do subscribe and share with your friends, and hit a like if you like my content. And leave in the comments below if there's anything you'd like me to do to improve, okay? Have a great day. Bye.